moving right along. I'm Nancy Wellman, and it's my pleasure to be the moderator of the final session called Research Priorities and Gaps. But before I introduce the first speaker, I want to bring to your attention that the largest federal nutrition assistance programs for older adults, we didn't have room on the program for that, and so I want to point out two things. In your program book, I think it's on page 51 or so, is or 57, I believe. I don't know where it is. 57 in the program book is the most recent research brief from the Administration on Aging about how the nutrition program benefits older adults. So that's on page 57. Also, I have the one and only copy that we have right here of the Journal of Nutrition and Gerontology and Geriatrics that is on display outside. Along with that is a handout about what this special issue is about. And it is a special issue on home and community-based meal services for older adults. And Julie Locker, who was a speaker yesterday, was the guest editor of this, and she did a great job with her colleagues. And if you're curious about more information on home-delivered nutrition services, then this is where to look, and this paper will connect you with all the articles for free online. So, two resources there. Okay, so I am delighted to introduce our first speaker. Our session is called Research Priorities and, more important, Research Gaps. And Kaylee Thomas is from Brown University School of Public Health, and she also works at the Center for Innovation for Long-Term Services and Supports at the Providence VA Medical Center. So she's going to talk about documenting outcomes from older Americans' nutrition programs. Kaylee?
All right, thank you for that introduction, Nancy. And thank you, I'd like to thank the program committee for the invitation to come and speak with you all this morning at what is a very important and informative event. So before I launch into talking about outcomes and measurement, I thought it was important to give you a little bit of background about my research and the context from which I come at thinking about outcomes research and senior nutrition programs. I am a trained gerontologist and health services researcher with an interest in programs that are designed to enable older adults to remain in the community. A paper that was published in 2012 with my co-author Vince Moore and Health Services Research. We took a large a series of data from over 10 years. We looked at all different types of home and community-based services and their relationship to low care residents in nursing homes with low care needs. And what we found that over the decade, the one program that with increased spending was related to reductions in low care residents in nursing homes was the Home Delivered Meals program. So we looked at Medicaid and all of the Older Americans Act services, and that was the one program that came out significant. That was, in addition, that was one of the first pieces of research that really had suggested that home-delivered meals had benefits up and above nutrition and may be related to other indicators in the healthcare market. And so we received lots of phone calls from programs and states from the federal level and asking, what does this mean? Can you put this into context? So we published a follow-up paper in Health Affairs, Vince Moore and I, and we calculated the savings that states could recognize by increasing their capacity in home-delivered meals. And believe it or not, we found that spending a little bit more and expanding home-delivered meals programs could have saved $109 million in 2009 based on our estimates for Medicaid spending. 26 states would have immediately realized savings based on our results, with 22 others potentially realizing savings in the future. I've worked with Meals on Wheels America, funded through a grant by AARP Foundation to profile seniors who are on waiting lists for home-delivered meals. And that paper is upcoming in an issue of the Journal of Applied Gerontology. In that same study with Meals on Wheels America, we evaluated the effectiveness of home-delivered meals and the differential effectiveness in the type of delivery type related to a number of different outcomes for older adults receiving home-delivered meals. And currently, we're leading a study to evaluate the role of home-delivered meals and healthcare utilization. So linking that to Medicare claims to really look at health and healthcare utilization among these vulnerable older adults. And before I began any of this work, I was a Meals on Wheels volunteer, and I was the granddaughter of a woman who was able to remain independent in her home until she died at the age of 98 with the support of Meals on Wheels and the Commodities program. So I spend a lot of time thinking about these programs and the potential impacts that they have on the lives of older adults. And when I think about program impact and performance measurement, it's important to kind of cast that into the different ways that programs can show their value. So we have inputs. So programs measure what they use to do the work. It's important to have measures of processes. So what do these programs do and how do they do it? It's important to have measures of outputs. So what are these programs producing? And most importantly, it's important to have information about outcomes and what they wish to achieve, because as you can see in this diagram, that it's a feedback loop and each one informs the other. So because of current reporting requirements, senior nutrition programs do a really great job at measuring inputs. They can tell you about their funding and the resources that they use, their missions. We can document the legislation that enables them to provide their services. They currently can tell you about their infrastructure, and the Administration on Aging's recent nutrition evaluation can tell you about the costs and a little bit about their infrastructure. Programs are measuring their staffing, the number of staff that they have, the vendors and food preparation facilities that they contract with. They can report to you the number of volunteers that they are able to recruit and retain. We know the numbers of people receiving meals. We know their characteristics. We know the number of unduplicated meals that older adults in America receive. And we have some measures of client satisfaction. And programs are doing a great job at measuring all of these three things. But when it comes to outcomes, we really don't know a whole lot. So where can we go to find current measures of these programs? The National Survey of Older Americans Act participants is a telephone survey with approximately 6,000 clients of Older Americans Act programs. About 1,000 of them receive home-delivered meals and 900 receive congregate meals. Participants are asked about how often they receive a given service, how they feel the service has impacted their lives, how it's met their physical, social, and emotional needs, and the interviews are conducted yearly. There's also the Performance Outcomes Measurement Project, which was developed by the Administration on Aging in collaboration with state units on aging and a number of universities and AAAs. And the toolkit is a culmination of the grantees' development efforts and provides step-by-step instructions on how programs can go about measuring outcomes. And it's publicly available. And then there's the scholarly research and the gray literature. There's a wide spectrum of published papers and reports about program outcomes. Well, why am I here speaking to you today? Because there are some limitations to our current evidence. The National Survey of Older Americans Act participants is cross-sectional, so it measures participants' feelings at one point in time. It's not longitudinal, so we don't really know how participants are changing from receiving the services. It's self-report, so they're telling us how they feel that the service has helped them. And there's really no adequate comparison or control group to base these improvements. The POMP project it uses a lot of the same instruments that are found in the National Survey of Older Americans Act participants, and it's not required and it's not collected in every state. And when it comes to the scholarly research, colleagues at the University of Alabama in the journal article, in fact, an article in the journal that was referenced earlier, did a systematic review of the literature about home-delivered meals specifically, and they found that over half of any paper that's been published since 1965, since these programs began, they were the Older Americans Act, excuse me. They were primarily descriptive, just describing clients' needs. And those that had focused on outcomes and were more rigorous focused on nutrition status and self-reported nutrition status. And the evidence is really based on cross-section, and those that have looked at other outcomes, the evidence is based on cross-sectional, so it's not longitudinal, it's small sample sizes constrained to a particular geographic region, and that therefore limits the generalizability of our work. So it's really important that we think about measuring outcomes for senior nutrition programs. As I mentioned earlier, it's a feedback loop. So having information about outcomes can inform and have implications for the rest of the service delivery system. In addition, outcomes measurement has critical importance to the Administration for Community Living, the Aging and Nutrition Networks, service recipients, and their families. Because key policymakers at all levels of government, from the Congress and OMB to the state and local governments, are relying on outcomes information to make budget decisions. And increasingly, funding for health and social programs are based on the outcomes of these programs. So while we know from anecdotal evidence, and I'm pretty sure every one of us in the room believe that senior nutrition programs are of value and that they really matter in the lives of older adults, the outcomes research is really needed to ensure the sustainability of these programs and the aging and nutrition networks more broadly. But it's difficult to measure outcomes, and it's difficult because, particularly in this case, because who's ultimately responsible here? Is it the programs? Is it the AAAs who contract with these programs? Is it the state units on aging? Is it the Administration for Community Living? Is it the research and academia? There's really no one to hold accountable for documenting outcomes. And resources make it a particular challenge. There's financial resources. So the administration that oversees a lot of these programs and states and programs themselves are already trying to operate on a very constrained and tight budget. So to add one more thing for them to do without financial resources just isn't practical. And there's also there's been limited extramural and intramural funding for senior nutrition program research. And in fact, it's almost been non-existent. And then there's the issue of uniformity across programs. It's difficult. I've learned through my research with working with a lot of these programs that they vary dramatically from site to site. The information they collect, the software they use, it's not standardized. So it makes it difficult to culminate all of this information to produce generalizable outcomes. And then we're left with the really big question: what outcomes should we be measuring? So ideally, we should be measuring what the Older Americans Act, which is the basis for a number of these programs, has put into law that they should be meeting. So are they reducing hunger and food insecurity of older individuals? Are they promoting socialization and the health and well-being of older adults? Are they delaying adverse health conditions for older adults? And we know this anecdotally, and the work that I have done with my colleagues has gone a long way to make strides to show that these programs are meeting these objectives. But it's important that we consider not only what the programs were designed to achieve, but also what outcomes are important to different stakeholders who are making decisions about these programs and eventually will determine the sustainability of them. So there are some measures that are particularly important to policymakers and payers. And they consist of, do these programs improve participants' health statuses? Do they prevent injuries? do they prevent secondary health outcomes like malnutrition and falls? Are they able to maintain individuals' community living and their independence in the community? Are they decreasing unnecessary rates of healthcare utilization? Are they preventing early mortality and extending life? And essentially, are they cost effective? Not essentially, but importantly, are they cost effective? And it's important to consider outcomes measures that are relevant and important to caregivers. So are these programs reducing their strain, their burden, their depression, and improving their health? And in fact, I believe the value of these programs to caregivers is something that's not fully been discussed and thought about, and we have a lot of, it's an untapped measure of these programs' performance. And then finally, and probably most importantly, what outcomes measures are important to the older adults that these programs are designed to serve? Obviously, their quality of life is a major outcome. Are these programs promoting socialization? Are they encouraging individuality and autonomy? Are they helping older adults to either establish or maintain relationships? Are they promoting dignity? Are they helping older individuals feel safe and secure? Are they promoting independence and ability to remain in the community? And then finally, the sense of security and safety about being able to remain in their homes. So how are we going to go about collecting these data? This is something that I'm sure a number of us in the room grapple with on a daily basis. Me probably more than most, being a researcher. But I will say that there's no need to reinvent the wheel. There are lots of survey instruments that have been validated and tested that we can use to survey recipients. As I mentioned earlier, it's important to get the perspective of the families or the family caregivers and perhaps conduct surveys with them. There's also the opportunity to have data capture by programs at regular intervals, similar to a number of other settings. And just to give you an example of one program that we're working with that has really taken this to heart, they participated in the More Than a Meal study, which the executive summary is in your program booklet. But the Aging and Disability Transit Service received board approval and funding to interview clients when they call and say, hey, I need services. They ask a variety of questions related to health, quality of life, depression, their social isolation, food insecurity. So it's a very holistic approach, and then they can help refer them to other services. They then survey them once they begin receiving services, and then they survey them annually. So then there's the ability to have longitudinal measurement of the improvement in outcomes for these participants. And it's possible that we could, granted not unfundedly do this, but it's possible that many programs could implement similar types of data capture programs. There's also the potential to link client data to medical records. We're about to embark on a project to do just that retrospectively, and that will have valuable insights into the health and healthcare utilization of clients and seniors who receive these programs. But there's also the potential to consider linkages to others, all payers claims databases that exist in a number of states, or incorporating them into other live databases so that older adults who are recipients of these programs can be followed prospectively, and we can track their health and healthcare utilization. And then there's really value in having a large pragmatic trial. The pilot that we conducted with Meals on Wheels America and funded by AARP Foundation showed that this is possible. You know, we had a positive pilot. We had signals that home delivered meals make a difference, and that differences vary by type of meal delivery. Older adults can be asked and are able to answer these questions. Programs can do this type of work. So we have the evidence base to guide a larger pragmatic trial to evaluate and inform a larger study. So where do we go? What do we continue to think about? That outcomes measurement is really important. I don't think anyone would dispute that. And I hope I've made the case to you that we should and we could and we really can measure outcomes. And while we know in our hearts that senior nutrition programs are really matter, and we wouldn't all be here. So it's important that we go further in our ability to document what these mean in the lives of what these mean for clients and their families. And by doing so, we'll have a better understanding of the unmet need of older adults who receive these services, as well as an understanding of the people who aren't receiving these services but perhaps could benefit from them. By doing outcomes measurement, we'll have a better idea of what types of models work better and for whom. So there's really, I can't say that there's one program across the board that works for everyone. So it's important that we have information to guide our decisions and referrals to different types of programs. With outcomes measurement, we could continue to do subgroup analysis, which could help us inform targeting older adults who may benefit most from these services, as well as prioritizing those who are on waiting lists. And as we know, the waiting lists for a number of these federally funded programs and state-funded programs and local funded programs are growing. And then we could do a cost effectiveness or cost benefit analysis, which is kind of the holy grail when it comes to outcomes measurement and proving the value of these programs. But I will say that all of this is dependent on robust and diverse funding and resources from all levels, from the local level to the federal level to non-traditional funders, in order to support the Aging and Nutrition Networks, the Administration for Community Living, and researchers to do this type of work. So with that, I'd like to say thank you. My contact information is here, so if I don't get to chat with you today, I'd love to have your emails, and I'm happy to share resources that we mentioned today. So thank you.